I think, first of all, listening to the consumers. These stories are typical, whether they're people in Chicago and the Collar counties. I am the executive director and medical director of a freestanding nonprofit AIDS service organization in Joliet. So I'm outside of the Cook County area in the Collar County, and I think meet some of the same, or have some of the same challenges as many of the downstate agencies have. But the client needs as presented are very, very similar. What it takes to meet those needs may vary dependent upon where we are. And I think just to emphasize, Eric is an example of the person that comes in, needs ADAP to turn his life around. It doesn't mean he will stay on ADAP for his entire life. ADAP was, and the Ryan White programs were created as a safety net. And that safety net was to help the uninsured, underinsured individuals until they were able to either get onto an entitlement program, which they were eligible for, or until they were able to get into the insurance system and back on their feet. So I think Eric is an example of the success story of what ADAP can accomplish with the Ryan White programs. Matt is typical of some of the people in my program. I have a number of small business owners. And if it weren't for ADAP, those businesses wouldn't exist. People would be closing the doors, and they would very likely, the easiest thing is to close the doors and go on to Medicaid. They want to stay alive. They want to access meds, and often that's the easiest direction to go. So ADAP helps to keep small businesses open, to help the families and the person, the business owner, but also, of course, the employees and their families. Those people remain taxpayers because of ADAP. But when I think about medical care before the drugs and now, I remember watching people deteriorate and die. Death was almost, if not an everyday and every week experience in every phase of my career. We didn't see people get better, and in fact, there was a period of time where I'm not sure that many of us expected to ever see that. Okay. When someone was diagnosed, we knew the majority would deteriorate, go on disability, and ultimately die. If they developed an AIDS-defining illness prior to 94, 95, within 2 years, probably 85 to 90% of those people were dead. With everything that we could do, didn't matter. And we had some HIV drugs that are nothing effective. Okay. Since the mid-90s, with the drugs that we have and the fact that we've had programs like ADAP to make them available to effectively very close to everyone, every citizen in Illinois living with HIV. Since that time, we see just the opposite. You saw it in the graphs that Dr. Barker gave you. But we see people who may present with an AIDS-defining illness, and now 5 years later, 85% of them are alive and doing well. People who were near death are looking healthy, their immune systems are strong, and often they're able to return to work. ADAP is a part of that happening. ADAP provides that ability to access meds until people can get to the point to move to other programs and hopefully to move into the workforce again and to access insurance. Without ADAP, or with cuts, if we make cuts, no matter how we make them, we're going to be going back to that pre-1995 era. So when you talk about, are these drugs that keep people alive, are these things that should be a priority? Absolutely, these are drugs that not only keep people alive, but improve quality of life. They lower the costs of many other programs. The hospitalization costs, the cost of antiretroviral therapy is offset by the decrease in hospitalization costs. In reality, there are numerous studies that tell us that the cost of the HIV drugs cost less than what hospitalizations cost us before.